Hi, so this one is going to be super quick. I had a lot to fit in. It's going to be about Dewi Evans again. First I'm going to say thank you so much for all your comments and feedback, not just on my channel, also on all the other channels that are dealing with the Lucy Letby case. They really helped to fill in the gaps, and they ask questions, so they get people thinking about all the other possibilities, and they inform. It's really important that you keep giving your very valuable feedback to all our channels. Okay, so there's been an article in The Guardian today about Dr. Dewi Evans. I'm sure Carl or Tasha or Mark has found it and covered it. I haven't looked at my YouTube yet, so I don't know what's really been going on. So after I made my video yesterday about Dewi Evans, I started having a bit of a realisation, and I think it is important to say what's on my mind. There's something about him I don't like, but you know, some people can look grumpy and, you know, be the sweetest people on earth. But going over what I was saying yesterday, and so yeah, this does include some trigger warnings because I will be touching a bit on what I said. I'm going to say Dewi Evans is a sadist, and I don't just mean as a description, and I will back up what I'm saying. I mean, on a clinical scale, I would call him a sadist. Okay, so we go to back this up. I mean, along with Jairam, he's been making the most noise about other people making noise and other people contradicting him, and it's causing distress to the parents of the babies that died. So therefore he knows what distress is, he knows what empathy is, so, you know, he knows what people's feelings are, and, you know, the sort of things that might hurt people's feelings. So he knows it. Okay, so we're going to flip back to what I was talking about yesterday, and that's about SA offences against children. Okay, so for those who didn't see that, in the 90s, and this was roughly around the same time that prisoners were taken in a hotel in Iraq, and I think it was the first Gulf War, so it was around that time. He was at a conference in Neath Port Talbot about child protection and helping children who are victims of SA, and he said that the perpetrators of these offences should be decriminalised. So he said that in the conference, that these offences should be decriminalised because the offenders they don't have the insight, they don't think they've done anything wrong, they, you know, so they don't see that they need to be punished or do anything different. So he knows, you know, about people's feelings, he knows about empathy, and can you imagine turning up at a conference, you know, which is devoted, or the focus is on helping children who have been traumatised because they're victims of these offences, and saying that is like the worst thing you could possibly say. And that's why I say he's a sadist. He must have known the effect his words would have had. I mean, apart from being a glaring red flag, because we're talking about the 90s now. So this was before everything about Jimmy Savile and Rolf Harris and Gary Glitter, you know, so that was before all that came out, and Michael Jackson as well. I wonder if he'd say stuff like that these days, because that would I mean, if he said something like that these days, the focus would immediately be on him and why are you saying that? I mean, you know, maybe you need investigating. And I think, from what I've seen, because we know he had the case with Linda Lewis, that was the lady whose child was taken away on grounds of Munchausen's. Well, there was no Munchausen's, so the child had a genuine illness. Now, someone mentioned that the boy who died with Addison's, that was not Dewi Evans, that was another doctor who completely effed up, basically, but it wasn't him. But I believe, from you look at how that was done, the Linda Lewis case was done with maximum harm to the mother, maximum harm to the child, because the child had an actual illness. That child could have died. Maximum harm to the family, because the family was split up. The whole way it was done. So I think that he has indulged his sadism, as part of his medical practice. That's where it's been an outlet. And I mean, some people, when they're like that, they can be, you know, the nicest people at home. You wouldn't think it of them. But we already know he said that as what he said at a conference. We know about his history with Linda Lewis. You know, there was nothing about that that was done to soften the blow, and everything that was done to make it as egregious as possible, and he did that. I mean, it's all the records are there, the letters are there, it's all there in black and white. Also with Lucy Letby, the way he's done it, it's everything the you know, to cause maximum upset, to cause maximum harm, and not just to Lucy Letby, but think of all the other people, you know, who've been connected with this, the other doctors, the other nurses, the patients, the parents, the relatives of the patients. So I think, and the reason I'm saying it is because I think it is relevant within the Lucy Letby case, but I think also I'm so concerned about what I've seen, the material that is out there, in his own words, in his own writing. I think think it does need to be put out there, and you know, if someone goes, yeah, we need to investigate this, we really need to investigate this, then that should absolutely happen, because this could happen to somebody else, so we don't want that happening again. Anyway, that's my bit for today. Very rushed, but I hope it was useful, and please like, subscribe. Hope to see you in the next video.